Hi there. It's Rebecca Clem. Greetings from Tennessee. Sorry I can't be there with you guys in person, but hope you're all doing well and staying healthy. My first presentation is on substance abuse and misuse. First, we need to define what a drug is. And a drug per our textbook is any substance other than food intended to affect the body and affect the body functions. Substance abuse is the deliberate and persistent and excessive use of substance without regard to health concerns or accepted medical practices. As you can see from this chart here, it doesn't really matter who you are. Let me move my head over here. But drug abuse and substance abuse touches around half of our U.S. families. And as you can see here on the far right, even weekly churchgoers have quite the high percentage of drinking and drug alcohol use. So it's not something that skips any generation really or leaves anyone untouched. Substance misuse is something we might see a lot more of. It's with people who are misusing a substance for unintended purposes, or they're using it for the right purpose, but they're doing it in improper dosages. So taking too much and just not staying in control of their medication. These are often referred to as legal substances, illicit or non-controlled substances. All right, so there's 6 categories of substances, and the way that they are categorized is what they do and how they affect the central nervous system, or the CNS, and the way that the substance is taken. The first category we're going to talk about is stimulants. Stimulants, their substance names would be caffeine, cocaine, crack cocaine, amphetamines, methamphetamines, dextroamphetamines, nicotine, ephedra, over-the-counter diet aids, asthma treatments, some decongestants. What these stimulants do is they speed us up. Our physical and mental activity gets more quick. We're able to move faster. They help prevent fatigue. They help suppress appetite. Sometimes people will take diet drugs to make it so that they can lose weight. So the stimulants, other common names are, that you might have heard, Coke, Snow, Nose Candy, Blow, Flake, Lady, White, Snowbirds, Powder, Foot, Crack, and I won't read the rest of them. You can see them, but there are quite a few of them, and they range obviously in realms of their severity. So obviously crack cocaine is a much higher, will affect you much more than caffeine will. But we know that caffeine can be addictive too. So there's a little bit all across the board on these stimulants. We also have hallucinogens. These change your mood, your sensations, and your thoughts. They can alter your perceptions of space and time. So oftentimes these people will be at a party or a rave or something like that, and they won't know how long they were actually gone, or where they were, or where they are in space. They might often feel disoriented or just completely out of touch. They might come back off their high, really wondering where the time went and what happened to the day. There's several different names for them. Ones that we might have heard of more frequently are LSD, PSP, peyote. There's several of them that are here. Mollies are becoming very popular street drug as well. Common names that you might know of or heard of, or should be aware of if you are in the health industry or just trying to help somebody who might have a drug or alcohol problem. Psychedelics, acid, white lightning, sugar cubes, angel dust, cactus, mushrooms are also in this hallucinogenic category. Inhalants. This one is, something that most people don't think of as like a as hardcore drug abuse or misuse, but these still affect the body and the system and the central nervous system as well. This right here is a whippet. This is nail polish. Laughing gas is like what you get at the doctor's or the dentist's office to help relieve some of the pain that they might be doing in your dental work. Common names: laughing gas, whippets, glue, lighter fluid, etc. The whipped cream from Thanksgiving, the pumpkin pie or whatever, those are all inhalants. Possible effects of these are they will alter your mood. You might lose some loss of feeling, might affect your motor coordination, and there also can be long-term damage to the heart, your lungs, brain, and liver. The cannabis products, these are becoming more and more popular as they are now legal and easy to get with pretty much anywhere, but you also can have a medical license for these too. They're called hashish, marijuana, THC. You can get them in cream, you can get them in edibles, you can get them in injectables like cannabis, and the cannabis products or the CBD oils are incredible. But the difference between those and this is that most of those oils don't have the THC. It's the cannabis part that's actually helping them, the people feel better. Common names are hash, pot, grass, reefer, Mary Jane, etc. And what cannabis products or pot or cannabis can do to you is produce feelings of elation, increase appetite, redden your eyes, increase your heart rate, just kind of give you a glossed over feeling. Depressants. This is a big one. We have our barbiturates, benzodiazepines, narcotics, alcohol is also in this one, antihistamine, sedatives, tranquilizers. So you can see how this could be something that people could overdose or misuse quite frequently. Common names are Valium and Xanax, downers, goofballs, quaaludes, ludes, date rape drugs, the Rohypnol's in there, Special K. And what these do is they decrease your mental and physical activity, they alter levels of consciousness, they relax your muscles, impair your judgment. And as you can see, if you've ever seen anybody do an alcohol test when they're pulled over by the police officers, anything like that, oftentimes these other people who are on these depressants will have the same type of loss of muscle coordination. And all right, the other one is the opioid narcotics. These include morphine, codeine, heroin, oxycodone, methadone, and opium. What these do is they relieve pain, they produce kind of a stupor or euphoria. They're very highly addictive. Oftentimes, these opioid narcotics will be prescribed with a medication called Naxalone, which helps reverse the effects of these drugs. Here's a little video on this.
Yeah, I think what's really important about naloxone, and it's always been the case, is that anybody who is at risk for having or witnessing an opioid overdose should be trained in recognizing an overdose and how to respond to it and consider getting naloxone. A lot of the effort in the last 5 years has focused on police and first responders. And that's an interesting and important group. In our work in Washington State distributing naloxone, though, we're finding about 1% of the naloxone we distribute to police is actually used in reversing an overdose, as opposed to more than 25% of the naloxone we distribute to people who have opioid use disorder and their friends and family. So this idea about getting out naloxone to that broader group of people is really important and likely to have a bigger impact. There are multiple ways to get naloxone.
As he's saying here, it's becoming more and more popular for sometimes even without a prescription for pharmacists to prescribe the naloxone with the opioid narcotics just in case there was to be an overdose. And so it's not a bad thing to know how to use this. Common names would be pectoral syrup, Oxycontin, Percodan, Percocet, Smack, Horse, Mud, or Brown Sugar. So different street names there. Like anything in our health, our eyes tell a great deal of what's going on. The eyes tell the story. So this right here is kind of a cool picture. I thought it shows what your eyes look like when they're on the different drugs. So on the opiates, you can see that the pupils are like pinpoints and their eyes are kind of droopy. Amphetamines and MDMA, they have a dilated pupil, like you can almost not see anything but the pupil. Marijuana, usually see dilated pupils, but most definitely the red eyes or dry eyes. And then with alcohol, the eyes are usually droopy and glassy, watery, just kind of out there type of look. So that's kind of a cool slide to just show like the different effects and what your eyes can show. Our role as an EMR, always summon more advanced medical personnel no matter what, as we know. We don't need, for initial care, we do not need to know what substance the person took. Rather, we want to always size up the scene like we normally do our primary assessment, summon more advanced medical personnel, take our sample history, and calm the patient, make sure that they're not overheated or getting chilled. Just basically keep them as comfortable as possible as long as they're not hurting themselves or others. This is kind of a eye-opening graph here, how alcohol and drugs affect everyone. This one is like a big one right here. Parents are the most likely the source of alcohol for children, 12 to 17-year-olds. Between ages 12 and 17, 40% have had a full serving of alcohol. So like it's affecting our youth earlier in much more frequently than it ever was before. And it's costing billions of dollars, and the negative effects on our population are huge. And in closing, just remember, drugs are bad. All right, thank you. Have a great day. Bye.